In this short video, we will consider the psychological impact that the coronavirus might have on children and young people, and in particular the difference between normal reactions to a highly abnormal situation and reactions that could be considered to be more traumatic. My name is David Trickey. I am a consultant clinical psychologist at the Anna Freud Centre and co-director of the UK Trauma Council. I have specialised in working with traumatised children and young people and their families for more than 20 years. The first thing to mention is that when we talk about the impact of the coronavirus, we are not just talking about the impact of a potentially deadly virus which spreads easily. We're talking about all of the indirect effects of the illness and the indirect effects of the measures that have been taken to reduce its spread. The sudden and unexpected bereavements where children and young people may not have had the chance to say goodbye and may not have been able to attend a funeral. The isolation that comes from lockdown and social distancing. The disruption to people's usual routines. All those things that children and young people have missed out on, such as lessons, lectures and exams, parties, sport, activities, play, contact with extended family. These are the psychological side effects of this dangerous illness and the measures taken to control it. As such, this could be considered as a potentially traumatic situation. So it's completely normal and even healthy for many children and young people to react to such an ongoing stressful situation in all sorts of ways. They may well appear more anxious than usual, looking out for and avoiding various things. But that's not only normal, that's actually healthy and possibly useful. That anxiety will make them more likely to take appropriate steps to reduce the chance of the virus spreading, which ultimately increases safety. They may well spend lots of time mulling over the situation and worrying about various aspects of it. They may have a strong desire to find out more information, but they may end up getting that information from the news media or the social media, which may seek to sensationalize rather than inform and reassure. Children's play may start to incorporate themes from the situation, such as families staying at home or illnesses. Children and young people may find it more difficult to sleep, and if they do sleep, they may have bad dreams as their minds continue to process whilst they sleep what is happening around them during the day. They may become more clingy to their carers and get very upset if separated from them. For example, a child might want to sleep in their carer's bed or start to misbehave at bedtime to try to delay having to be on their own. Some children and young people may start to have low moods. Sometimes they may find it hard to feel motivated even for things that they used to enjoy, and they might at times feel hopeless. They may start to regress, for example, use more babyish language, play with toys that they had previously grown out of. They may be more irritable, lose their temper more easily, and even be more defiant. And let's face it, you may even recognise these reactions in adults around you, not just children and young people. These are all expected, normal reactions to a highly abnormal situation. And for a vast majority of children and young people, with appropriate reassurance, such reactions will diminish as the situation becomes more settled. Carers can play a key role in helping children and young people to develop a realistic and balanced view of the situation and maintain a certain amount of realistic optimism about the future. Such reassurance is much more effective if it follows a genuinely curious inquiry into what the child or young person is worried about. And the reassurance can then start by reassuring them that their reactions are completely understandable, and then start to address the worries that the children and young people have about the situation. If you are working with or caring for a child or young person with these sorts of difficulties, there is a lot of advice available to you from various sources, including the Anna Freud Centre website. So when should you be more worried? When might their reactions suggest a more traumatic reaction? Well, traumatic reactions may be very similar to those that I've just mentioned in type, but they are likely to be different in terms of severity, frequency, duration, and persistence. Severity. How extreme is their reaction? Do they just avoid people in line with social distancing measures, or do they avoid everyone, even those in their own households? Do they start to avoid leaving the house even when they need to? Do they have terrible nightmares which wake them up and they are then inconsolable? Frequency. How often does it happen? Do they have nightmares once every 10 days or so, or several times a night? Do they lose their temper several times a day or just occasionally? Duration. When these things do happen, how long do they last? If they lose their temper first thing in the morning, does that then last all day, or are they suddenly as right as rain? If they start to feel sad or low, do they bounce back pretty quickly, or do they spiral downwards for long periods of time? And persistence. How long have these reactions persisted? Have they been reacting like this for just a few days and weeks, or have the reactions persisted for weeks and months, even when things in the world have begun to improve? It's okay to keep an eye out on these things to see if they get better or not. The NICE guidelines recommend this and call it active monitoring. But if you are worried about a child or young person because of the severity, frequency, duration, or persistence of their reactions, then there will be various sources of support and advice available to you, some of which are displayed on the screen. But in particular, your GP or the child or young person's schools are likely to be a good place to start.